So I'm here today at Emmanuel Hospital in Portland visiting my friend Sis. And they have this gorgeous little courtyard out here, and so you can kind of see a little bit more. It just felt like a really good place to come out here and tell you a little bit about Sis's story. I met Sis in 2013 when she started coming to our Bible studies at Coffee Creek Prison. And you would never know that Sis was a recovering meth addict, that she was incarcerated for a low-level identity theft. She looks a lot more like a suburban Pentecostal church grandma. I mean, when we would play music in our services, Sis would have her hands in the air, praising God and clapping and dancing, and you just would never know. And so in 2016, Sis started complaining of back pain. And she told me that it was in her lower back and it was radiating down her leg, and my nurse brain said, sounds a lot like maybe a herniated disc or maybe some spinal stenosis. And I asked, have you requested to be seen in the health center? And she said that she had, but she just hadn't heard anything yet. So the weeks went by, the months went by, and we prayed for Sis's condition, but there was no response from the health center in getting her any care. And then finally one night in 2017, Sis lost control of her bowel and her bladder, and her leg went completely numb and limp. And at that point, she was rushed to a local hospital where they did an emergency surgery in the middle of the night for a herniated disc and spinal stenosis. These are not conditions that should warrant a emergency surgery in our day and age. I mean, they never should. So after the surgery, she was returned to the prison to heal, but you have to understand, prison floors are concrete. They're hard on anybody's back or joints. The beds are hard and not very supportive, and corrections officers, they are more concerned about you following their orders than they are about following doctor's orders that might include some limitations so that you can heal. And so instead of healing, Sis's condition just deteriorated. She ended up having 2 more emergency surgeries over the next few years. And in February of 2020, an MRI was done and determined that she needed another surgery to relieve the spinal compression on her spinal cord. And instead of making arrangements for her to get surgery, the Coffee Creek medical staff ordered physical therapy. But the PT refused to treat her until she was evaluated at an outside spinal specialist. And smart PT, honestly. So no care was ever provided, and she continued to deteriorate until she ended up in a wheelchair, having to self-catheterize in order to urinate, and in constant pain. So in November of 2020, our RI team did something that we never do. This is not in our wheelhouse. It's just not something we do. We appealed to the governor to release her so that she could get the care that she needed before her condition became permanent. And the governor released her, and she left the prison at the end of February. And then on Monday of this week, Sis was able to get the surgery that she has been needing for 14 months. She's going to go to rehab for a few weeks after this hospital stay, and hopefully, God willing, she'll be able to walk again. But it didn't have to be like this. If the Department of Corrections had just provided her the care that she needed back in 2016, her outcome would have been so different. And I'm sad to say that this is not unusual. As a prison minister, I see way too many cases where the DOC just doesn't provide care that people need. And in fact, chronic illness is the #1 cause of death for the people that we have behind bars in our state prisons in this nation right now. Even a year after releasing from prison, the formerly incarcerated are 4 times more likely to die than the rest of us. Their mortality rate is almost 4 times higher than the general population. And I have to ask, is that what we intend when we hold people accountable for breaking the law? That they would suffer bodily harm? It's almost like a Dickens novel where back in that day, everybody knew if you went to prison, you were going to die of disease. I thought that today we called that cruel and unusual punishment. I'm going to go back up and hang with Sis.